So we've talked numerous times about rising healthcare costs. And this graph shows from 1960 through 2005, inflation adjusted, the growth in real per capita spending by source. And so you can see that in 1960, it's around $1,000. Medicare and Medicaid were not around at the time. Private health insurance was relatively small. Out of pocket, as you can see over time, hasn't really changed that much dollar-wise. But what has happened, though, is over time, as Medicare has grown, as Medicaid has grown, as other government has grown, as private health insurance has grown, you've seen all this, and you've seen massive increases in spending. But again, that out of pocket, not really changing. Now, in an effort to combat that, some plans have been developed in recent years, and this is more of a newer phenomena, and they're called consumer-driven health plans. They're really high deductible plans. So the deductible is what you pay out of pocket before insurance kicks in. So these plans have kind of come out, and they're really a way to, mostly for healthier individuals, to have a plan with the lower premium and not as good of benefits, at least for the short run. So basically, high deductible plans are plans that, like I said, they have high deductibles. Okay? So what does that mean? If there's a high deductible, and let's just say, I'll make one up. Let's just say that there's a plan where you have to pay $2,000 before the insurance company kicks in. So if that's the case, anything up to $2,000 in medical expenses is coming out of pocket. So when you think about that, for example, let's say you have to go to the doctor. Now you're not just paying that copay. Right? Let's just say a doctor's visit costs $100 and the copay is $10 for most. Okay. Well, you're not paying that copay of $10 now. You're paying that full $100. So when it comes down to it, when you have to pay that full price for those small expenses, you tend to think about it more, and you're now less likely to go. So what these high deductible plans do is they cut down on moral hazard. And because people are going to the doctor's office less, insurance companies aren't paying out as much. Right? So what happens with these high deductible plans then is that, keeping in mind this idea of the medical loss ratio, you get what you pay for, and all that, because the insurance companies are paying out less, they don't have to collect as much in premiums. So the premiums are lower for these high deductible plans. If you look at an example here, we have, down here. So we have, we'll talk about these in a minute, but HMO, health maintenance organizations, PPO, preferred provider organizations, and point of service. You can see that the premiums, and this is a little bit outdated, but let's look at just single. So for single, one person, $5,560. All right, the employee pays $962. The high deductible plans have the lower premiums. And the reason why is that they have those higher deductible amounts. And with that, moral hazard goes down, so people aren't, they don't have to pay as much, they have to pay more, so now they're less likely to go. And if the insurance company, if they're going less, the insurance company is going to be paying out less, so they're going to be collecting less. So it's all kind of works together. Now, to help with these, because people have to pay a lot out of pocket, at least at the beginning, a lot of times they're paired up with health savings accounts, HSAs. And these are basically pre-taxed accounts to where, it goes directly from your paycheck in there before taxes are taken out. And it sits in that account, and then when you need to use it for health care, you take it out and you pay with it. So basically, this is pre-tax money that you have sitting there, right, that you can use for your health care. And so that helps with those high deductible plans. So these plans they're good for reducing costs. The problem is it really depends on who you are and if it's a good plan for you or not. If you're someone who tends to get sick a lot and need to go to the doctor a lot, it may not be a good plan for you. If, however, you're relatively healthy and you don't go to the doctors that often, this high deductible plan is good for you. And it really, really helps to keep your healthcare costs low. You're not paying as much as premiums. So this is just one effort that has been made to kind of try to cut down on the high costs and the rising costs of healthcare.